Welcome to today's Health Spotlight, where we'll be discussing leukoplakia, a condition affecting the oral cavity. We'll explore what it is, its causes, symptoms, and how it's managed. Understanding leukoplakia is crucial for early detection and proper care, so let's dive in. The exact cause of leukoplakia isn't always clear, but it's often linked to chronic irritation. Tobacco use, whether smoking or chewing, is a major culprit. Alcohol consumption is another significant risk factor. Ill-fitting dentures or rough teeth can also cause localized irritation leading to leukoplakia. In some cases, it may be associated with the Epstein-Barr virus, particularly in hairy leukoplakia, which is more common in individuals with weakened immune systems. Leukoplakia develops as a result of prolonged irritation to the oral mucosa. This irritation leads to an increased production of keratin, a protein that forms a protective layer on the skin and mucous membranes. This excess keratin accumulates, causing the characteristic white or grayish-white patches. The cells in the affected area may also undergo abnormal changes, which in some instances can potentially lead to oral cancer. The thickened patch is essentially a protective response to the constant irritation, but it's a response that can sometimes become problematic. Leukoplakia's prevalence varies depending on the population studied. It's more common in older adults, particularly those with a history of tobacco and alcohol use. Studies estimate that leukoplakia affects between 1 and 3% of the adult population worldwide. Geographic location, cultural habits related to tobacco and alcohol, and access to dental care can all influence its occurrence. The primary sign of leukoplakia is the presence of one or more white or grayish-white patches inside the mouth. These patches can appear on the tongue, inner cheeks, gums, or the floor of the mouth. They may be slightly raised, hardened, or have a rough texture. Usually, leukoplakia is painless, but some individuals might experience sensitivity to hot, spicy, or acidic foods. It's important to note that leukoplakia patches can't be easily scraped off, which distinguishes them from conditions like oral thrush. Diagnosis of leukoplakia typically involves a visual examination by a dentist or oral surgeon. They will assess the size, location, and characteristics of the white patch. To confirm the diagnosis and rule out other conditions, a biopsy is often performed. During a biopsy, a small tissue sample is taken from the affected area and examined under a microscope. This helps determine the presence of any precancerous or cancerous cells. Additional tests may be conducted to rule out other potential causes. Leukoplakia can be classified based on its appearance and characteristics. Homogeneous leukoplakia presents as a uniform, flat, white patch. Non-homogeneous leukoplakia, on the other hand, has a more irregular appearance, with variations in color and texture. Verrucous leukoplakia is a type of non-homogeneous leukoplakia that has a wart-like or cauliflower-like surface. Erythroleukoplakia is another variant characterized by a combination of red and white patches, and is considered to have a higher risk of malignant transformation. The treatment for leukoplakia depends on the size, location, and characteristics of the lesion, as well as the risk of it becoming cancerous. In many cases, the first step is to eliminate any known irritants, such as tobacco and alcohol. Small leukoplakia patches may resolve on their own once the source of irritation is removed. Larger or more suspicious patches may require surgical removal, either through conventional surgery, laser ablation, or cryotherapy. Topical medications, such as retinoids, may also be used to reduce the size of the lesion. Regular follow-up appointments are essential to monitor for any recurrence or signs of cancerous changes. The best way to prevent leukoplakia is to avoid or eliminate known irritants to the oral mucosa. This includes abstaining from tobacco use in any form and limiting alcohol consumption. Maintaining good oral hygiene, including regular brushing, flossing, and dental check-ups, can also help prevent irritation from rough teeth or ill-fitting dentures. Protecting the lips from sun exposure with lip balm containing sunscreen is also important. The prognosis for leukoplakia is generally good, especially when detected and treated early. Many cases resolve completely with the removal of irritants and appropriate management. However, leukoplakia can sometimes transform into oral cancer, so regular monitoring and follow-up are crucial. Recent research is focused on identifying biomarkers that can predict the likelihood of malignant transformation and developing more targeted therapies for high-risk lesions. Some studies are exploring the use of antioxidant supplements and chemopreventive agents to reduce the risk of cancer development. Early detection and prompt treatment remain the cornerstones of managing leukoplakia effectively.